Over the last year, I've been talking to my patients more about the term weathering. And what weathering is, it's a phenomenon that was first coined by a public health researcher named Arlene Geronimus. And she explains, based on her research, that chronic stress that happens to people over time increases your risk of developing chronic diseases and prematurely ages people. And if you happen to be of a marginalized group, you are undergoing more chronic stressors on the daily, and that increases your risk of developing chronic diseases. And so I like to share with my patients this because I think we've been taught, particularly people of color, that there's something in us that causes us to have high blood pressure and other chronic diseases, when actually the things that happen to us perpetuate a lot of that. And I think it makes people feel like the things that they are experiencing are real and are happening to them, and it's not just something that they were destined to have. I think they feel validated in knowing that this daily stressors that they have are affecting their health because they feel it. And I think before using this term, people did not know that these daily stressors can affect people in such a big way. It can be overwhelming too for people to hear about this, but I do think overall there is some empowerment in knowing that your feelings are accurate and valid. Like, chronic stress is a big deal. Why is it, if you're of a marginalized group, people worry frequently about, their job. Why am I being treated differently at work? Why is my kid being called out of school? Why do I have to talk to my kids about how to respond if a police pulls you over? All of those things on the daily create chronic stress for people, and it's not just in their imagination. It does affect your health, and when you are chronically stressed, you release hormones in your body that creates change over time. And I think acknowledging that for people is a big deal.